The Dr. Fazil Show is brought to you by Health Tips Media. The Dr. Fazil Show is intended for health education purposes only and complies with all HIPAA regulations. All of the CDC guidelines for COVID-19 safety were followed while filming this episode of the Dr. Fazil Show.
Hello, ladies and gentlemen. I'm Dr. Fazil. This is Dr. Fazil's TV show. It's August 2023 show. I'm also a primary care as well as kidney specialist and nephrologist. Today I'm going to talk about bone disease in chronic kidney disease. So we say somebody have chronic kidney disease if they have a chronic kidney function less than 60%. Or, that's kind of layman terminology, but 60 or less is chronic kidney disease. So if you have chronic kidney disease, then especially stage 3, which start from 60 to 30%, that's where a bone disorder can start to happen, and the bones become brittle. Now, this bone disease is different than the osteoporosis or osteopenia, which most people get with time. Like female get more than men, but everybody gets it one way or the other if they have risk factors. And for that, we do like a bone density test with DEXA scan. But this is a different kind of bone disease I'm talking about today. This is known as renal osteodystrophy. Bone disease due to kidneys is not the same thing as osteoporosis or osteopenia. It's a different bone condition. You cannot diagnose this one with a DEXA scan. So it is diagnosed through a blood test, which we do to check the levels of the chemicals in the blood. There's certain kind of chemicals known as parathyroid hormone levels, and they can give you information if you have a low kidney function, 60% or below. If that parathyroid hormone level is high, most of the time we call it secondary hyperparathyroidism. There's 4 glands in the neck. They regulate your calcium and phosphorus balance in the blood. So when we eat vitamin D, it gets changed in the liver and into the kidney twice. One time in the liver, second in the kidney, to become an active vitamin D. So when the kidney function gets less, that process of activation it becomes lower. So you have less active vitamin D. You might have vitamin D, but active vitamin D, we call it 125 hydroxy vitamin D, which is active vitamin D, and that is the one which works on the bones. But then when it becomes less, people start to have internal bone disease, and they can have fractures, dislocations. Again, you cannot diagnose through your regular primary care tools like DEXA scan. It has to be done through a blood test. Mostly the kidney specialists do it. They have to know the range. The range is different for the parathyroid hormone level for each kidney. Stage 3, 4, and 5. There are 5 stages, by the way, of kidney disease. Stage 1 is normal. Stage 5 when someone needs dialysis. And in between we have stage 3, 4, and 5. So folks, make sure if you have a CKD stage 3 or more, if you have chronic kidney disease, do ask your doctor that, have you been checked for kidney bone disease, And it's easy to treat. There's an active vitamin D. Remember, regular vitamin D or vitamin D3 or D2, which is available over the counter, would not work because the kidneys are not strong enough to convert that inactive vitamin D to active vitamin D. So there's a prescription vitamin D known as calcitrol, or other sources. Calcitrol is one brand, but there's Zemplar, the other active vitamin Ds, which are required to fix this problem. So once you take it, the doctor or provider recheck the levels and make sure they're in the right range. If that remains in the right range, your kidneys, even though they are low in function, the bones will remain strong, and you will avoid the bone disease due to the kidneys, or kidney bone disease, or renal osteodystrophy.
Now you can catch up with all of our previous shows on all Roku devices. Simply search for the Dr. Fazil Show channel and add it to your home screen. View our videos online by visiting our website at www.drfazilshow.com. Our videos are available on YouTube by searching for The Dr. Fazil Show. And don't forget to subscribe to our channel. The Dr. Fazil Show is available in multiple provider office waiting rooms across Yuma, Arizona. Don't forget to get your copy of Health Tips magazine and read about this interview, currently distributed across Yuma, Arizona.
So folks, just FYI things for you guys. So when you go and if you to see your doctor, and if you know that you have kidney disease, there's multiple other problems which can happen along with that, along with the low kidney function. One of them is bone disease, so make sure you stay on top of that. And easy treatment is a special vitamin D. A regular vitamin D over the counter will not help. It's a prescription vitamin D, which you need to take. And generally it's like one tablet, one capsule 3 times a week or twice a week, depending on your range. But 3 times a week is a normal way of taking this vitamin D. It's a special vitamin D, it's the active vitamin D. And then serial level of blood testing, over the months, not the checking of levels of parathyroid hormone. Remember, parathyroid gland is not a thyroid gland. The parathyroid gland is a different gland. There's 4 glands in the neck on top of the thyroid gland. Those parathyroid glands are the one which regulate your calcium and phosphorus in the blood. As the calcium starts to drop, because vitamin D gets less in the blood due to weak kidneys, the gland kicks in and causes bones to leach out calcium into the blood to keep the blood level at the regular level, and that causes the bone disease. So folks, it's easy to fix it. So I just want to make sure that when you go to see your kidney specialist or primary care doctor or provider, if you have been told that you have chronic kidney disease stage 3 or more, then do ask if your bone disease is taken care of, or if you do have a kidney bone disease. So on that note, I will call it a day. This was Dr. Fazil TV show for August 2023 for kidney bone disease disorder, how to diagnose it, how to fix it, and be vigilant about it. Till that next time, Dr. Fazil here. Folks, God bless you, God bless America, and have a nice rest of the summer. Thanks so much.